My name is Nancy Page, and I am the GI Rectal Cancer Navigator here at Wellstar Kennestone Cancer Center in Marietta, Georgia. I have been with Wellstar for 20 years, but I have been here in the cancer arena for the last 10 years. Actually, my brother was diagnosed with renal cell carcinoma in 2013, and I didn't even know we had a cancer center here at Kennestone. So when I came over and with him for his appointments and saw what was going on and saw what the patients actually were going through and what they needed, I was at that point in my career. I've been a nurse now for 47 years. I decided that might be something that I wanted to go into. And the next thing I know, I'm taking care of one of the other navigator's husband in the area that I was working in. She said, "You need to come work for us." And I said, "I don't know, it's changed." And she says, "No, you really need to come." So I came and interviewed, and I thought, yes, this is where I need to be. I think I've always wanted to be a person who helps people, and seeing what these people go through and what their families go through. Any day I wake up and I don't have that diagnosis of cancer, it's a great day. So my motivation is to come in every day and to look at these people and do whatever I can to make their journey easier, better for them. I'm kind of torn with that because I have a patient that, bless his heart, he was 5 years older than me, and he worked himself into a heart attack, and then he recovered, did well, got back on the job, and then he had a stroke, and it was pretty devastating. And he was one of those people who believed in paying his bills, so he emptied his retirement account to pay for all of his rehab and everything, not being able to think clearly that he would need that money down the road. I wish he had somebody to help him then make those decisions. Fast forward, he is homeless, but he's living in an extended stay hotel, and he was diagnosed with rectal cancer. But I had heard in tumor board, I had never met him, that there was this cantankerous man diagnosed, and he was very difficult to deal with, and he had been not very nice to some of the staff people. And I'm thinking to myself, Lord, I hope I don't meet him. Well, the very next day in radiation, I get a call from the radiation oncologist. It says, "Nancy, can you come help me?" And I go downstairs, and it's him, and he is kind of having a little fit. So then I brought him up to my office, and I realized he needed food. He needed transportation. He needed help with some of his bills. So I was able to actually get him hooked up with Cobb County Meals on Wheels so that he would have meals. I was able to get him set up with the food bank so that somebody could come pick him up and he could go get food. We had a transportation bus here, and I was able to get it set up to where he could come here to the cancer center for his treatments, and his doctor's appointments, that he didn't have to worry about that. I got him, he was losing a lot of weight and he was having trouble swallowing. So I got him hooked up with our dietitian here at the cancer center, and she made some phone calls with the company and was able to have cases of Ensure sent to his hotel room for him. I got with our social worker. We were able to get some paperwork done to where he could get some money, not much. He budgeted his monthly allowance down to the quarters, like to 4 quarters a week to do his laundry. He was very meticulous. And he told me the one thing that he would not do, he would not die of homelessness or starvation. He said, "I can die of cancer, but I'm not going to die of that." I said, "Okay." Well, we actually got him through his chemotherapy. We got him through his chemoradiation, got him through surgery. And so as we got him through surgery, I spoke to a gastroenterologist friend of mine, and I said, "Hey, I need you to do some free bono work here for me." So we got him through the Wellstar Indigent program, and we did an EGD on him to see why he kept throwing up. Well, he went to pass the scope, and I went, oh my gosh, is that what I think it is? Because I was in the room, and he says, what do you think it is? And I said, that's a really tight stricture. And he said, yes, it is. So he was able to dilate him, and guess what? He was able to eat, because he'd been living off Bob Evans' mashed potatoes. That's the only thing he could get down. So all of a sudden, he's eating, and he's gaining all of this weight. He was very thankful for what Wellstar had done. And so he had hung on to all of his very, very nice suits that he had during his days of being in corporate America. Extremely like alligator skin shoes. Everything was like pristine. And he brought them in, and he said, I need you to donate these to somebody who really needs it, because he heard of the program Dress for Success. So he probably donated over $5,000 worth of clothes. And I said, I could take these clothes and actually get them like to a consignment store, and you could get some money. He says, no, I want to be able to help somebody else like y'all helped me. And that just touched my heart. So I was able to do that, and his clothes went to a Dress for Success program in Washington, D.C. So, fast forward, and he's in his surveillance mode, and I was in a quandary one day because my brother had an appointment at the exact same time he had an appointment, just 2 halls from each other, and I thought, how am I going to do this? Because both of them needed me, And I kept checking, and he hadn't checked in. And I thought, that's unusual, because he's always on time. Got my brother taken care of. I came back to my office. I called his hotel room, and it just rang off the hook. And I knew something was wrong. I called the front desk, and I said, I need y'all to go do a welfare check. And he goes, da, da. I said, no, you don't understand. I need you to go to do it now. And he came back 5 minutes later, and he goes, ma'am? And I said, yes. He said, he's deceased. We've called the police. But he died in his sleep in a hotel room, and he had a full tummy when he died. So I thought, you know what? I've made an impact for this man. He was able to impact somebody else's life. And that's... I helped him make his wish come true. And he had told me that he had no relatives whatsoever left. And basically it was just me. And so I didn't know this, but the medical examiner said that there's a database sheet where, where they can go in and look for long lost relatives. And he was telling the absolute truth. He had no one here in the United States. Wow. His parents had died, his brother has died, his cousin has died, his ex-wife had died. And it was just us here at the cancer center who'd been taking care of him. Wow. So that was me. But then there's another story of a young man diagnosed with pancreatic cancer. And this young man, he was actually taking care of his mother who had colon cancer. And I said, okay, do you have any other siblings? He said, yes. I said, I need your older brother to step up and take care of your mom, because we're going to be taking care of you. So they did that. He worked through his treatment. He was working on his master's. He completed that master's during treatment. He had like 3 major surgeries, lots of setbacks. But what amazed me was after his surgery, I go to ICU to see him, and he is on the vent, but he's awake, and he motions come to me. So I bend over. I'm short. I'm 5 foot, so I had to stand on a stool to get close to him. And he wrapped his arms around me. And then he mouthed to his brother, this is my Nancy. And every time after that, his family would call me my Nancy, And it was just the sweetest thing. And I realized what an impact I made, not only for him, but for his family. And when he lived like another 2.5 years, but during that 2.5 years, he and his fiance were able to travel to his home country where she met the family. He was able to finish his master's. He was able to continue work up until like 2 weeks before he actually passed, Wow. And so when he had his service, it was at a big cathedral. And I got there, and I'm thinking to myself, okay, this young man, this is going to be sad, because it's a big cavern. You just made a marble. It's going to be cold. There was standing room only in that cathedral. It was people he went to school with. It was people from work that he worked with. It was people in his social network there. And some people spoke, and I thought, this young man has made such a huge impact about his life and about cancer, not only his cancer, but his mom's cancer. And I realized I was just a small part of that. I do a lot of education because right now I'm also the Rectal Cancer Navigator and the NAPRC coordinator. We are accredited through the National Accreditation Program for Rectal Cancer. So that is one of the cancers. If you say rectal cancer, people are like, oh, I don't want to talk about that. That's so bad. I'm like, no, you need to get over that. Okay, it's just cancer of another organ, And so when people are given that diagnosis, when the doctor's talking to them, they see this. They hear nothing. They see lips moving, but their head's going crazy. So I break it down for them. I come to my office or I get them on the phone and I said, tell me what they said to you. What do you think that means? And then I break it down so that they can actually understand what's going on. And they went, oh, okay. Well, and the biggest thing is when I say I need to get a rectal MRI, they all freak out because they think something's going somewhere. And I went, no. You'll just be laying on the table with a nice warm blanket, a pillow under your head and under your legs, earphones. It's going to be okay. You're going to be fine. So I do a lot of education with that, especially with the treatment. I mean, the infusion nurses discuss, all the side effects of the treatment. But I'm the one that said, okay, this is how it's going to play out. You're going to come in, you're going to check in, they're going to check your blood, you're going to see the doctor or the NP, you're going to go to infusion, you're going to be there for a while. When you come, bring you a big bag with your favorite drinks, your favorite snacks, things to read, things to do. Bring your comfy blanket, things to make it better for them. Mm-hmm. And then I explain after that the chemoradiation part. What does that look like? What's that 28 days look like? And then I said, then you have a few weeks and you're going to have your surgery. Then I tell them about the surgery. And then when they go to have the surgery, I will actually go over and check on them because I have become like somebody they know. You're in a hospital, somebody is going to be cutting on your rectum, and that's scary enough, and you're in a hospital with people you've never seen before. So I'm a friendly face, and they know that they can ask me anything. And I also tell them I'm like their best buddy because if they forget to ask the doctor something when they came in, they'll ask me, I'll send a text to the doctor and get them an answer, So it's helping them through that really worst time. Some of these people will need financial help. And that's when I turn to our social worker, because some people do meet programs, but there's this class of people who they make too much, but not enough, and they need resources. So I hook them up with different agencies that can help provide food, or maybe pay an electric bill, or maybe get them some gas cards, things like that. Some of the rectal patients, I have one lady. She's very independent, and when she has to have procedures like lung biopsies, which she said several, and liver biopsies, she has to have somebody drive her because she can't drive home after sedation. She has to call a friend in Birmingham to take off work to drive to Atlanta to bring her. And so I had told the doctors, I said, you need to give us a few days notice so that we can make all these arrangements. So it's doing things like that. We just do whatever needs to be done to help these people get the treatment they need. The first thing I do, honestly, is tell them, okay, I need you to take a deep breath with me and let it out. And I tell them, I said, let's do it again. I said, you've just been given some news that nobody ever wants to hear, but the good news is we can treat this and we can get you through this, and we will do it one day at a time. I tell them, I said, you've gotten a diagnosis. Now what we need to do is get other pieces of the puzzle together. But that means we're going to get MRIs, we're going to get CAT scans, we might do some biopsies, we're going to do some lab work. And then once we put all those pieces together, we will look at that puzzle and come up with a plan just for you. And I said, and then we're going to do it together day by day. And I said, it's going to be a long haul, but we will do it together. And normally they'll go, then I check back with them, because even with that, when I call them back, they'll say, what did you tell me about this? What did you tell me about that? It's just a constant reminder because they are so overloaded. But just letting them know that, Prime example was last week I went to see a patient in the hospital. He only spoke Portuguese, so we used an interpreter. It's called Marty, so it's like a computerized. I love it. And so I was using the interpreter, and I said, I don't know if you remember me. It's been a few months since we last, saw each other. We've talked, but if I saw. And he started speaking Portuguese really fast, and I'm thinking, whoa, what's going on? And I'm looking at her face on the monitor, and she just kind of has this little look on her face, and I said, what did he say? And she said, he said he will never, ever forget your face, because the day he was told he had cancer, you were with him in radiation. His family was not there, and he said you gave him the biggest hug and told him not to worry, that you would help him get through this. And he said that's what got him through. Wow. And I went, wow. So I'm thinking, I just hugged and loved on this man. I'm a hugger. Thinking, okay, I just gave him a hug. But apparently it was more than a hug to him. And I realized then, it's the small things we do for our patients that make the big impacts. Use all of your skills that you had up until that point. I had spent most of my career in ICU and ER. So I had the critical thinking skills. And that's going to translate over into what does this patient need? What is going on right now in their life? What is the number one issue they have? So you can size it up pretty quick. What's the first thing you need to do for them? The other thing is, do not judge a book by its cover. Because that first patient I told you about, the gentleman who was homeless, to look at him, you would think, ugh. But he was a very powerful exec at one time. He was still that person on the inside, but the outside had changed. Never judge a book by its cover. I saw a patient one time that was just as cool as a cucumber, but once I got to talk to them, they were a basket case. So you have to sit and talk with the patient to see exactly where they are. Understand that every patient is going to be different. How people deal with their own diagnosis is going to be different. And you have to figure out how they're dealing with it and meet them there. Or if they're dealing with it in a not so good way, find a way to where you can kind of bring them back down and help them cope with it as they're getting their treatment. It is amazing to me. So in 2013, Wellstar here at Kennestone went on Epic, the electronic medical record. And everybody said, oh, because we did paper charting. Right? And we were like, oh, this is so difficult to learn. Oh, this is so bad. So then once we got used to it, it was like when it's something that went wrong and we had to go downtown and we had to go back to paper chart, and we were like, oh, this is such a pain. Oh, this is so bad. Now with the electronic records and being able to pull up information so fast, I could have one screen up and they can ask me something, and I can pull the other screen up, get that information, and get right back to them. I call it the Age of the Jetsons. I don't know if you remember that cartoon series. I'm just looking for that machine that will do my hair and makeup for me, because we already have the people mover, the microwave, and we got the cell phone with the video, just like what we're doing now. But technology has really made it so much easier to share information from site to site. It's been great. Not real good at that, I'll be honest. I'm the sole caregiver to my mom. She's 91 and a half, and she lives 30 miles from me. So if I'm not at work taking care of people, I'm there taking care of her. One of the things I do is, one of the days of the weekend, because I'm up there the other day of the weekend, the whole day, I have a sun porch on my backyard, enclosed sun porch. And I will go out there with my coffee. And I will sit there and I will read, or I'll get a magazine and I will read. And my husband and I, we had some yard work done last year, and we have a big deck, and we have all kinds of bird feeders and things up. And I just take that time and just enjoy nature, enjoy the solitude, and just appreciate the fact that I live where I live, that I have the life that I do, that I have a loving family, and just try to enjoy each day.